All right, so my name is Dr. Zanaya Zersi right here. I have my patient, Dr. Leilani Marie. She is getting liposuction in a Brazilian butt lift. Now, Leilani, I'm just going to ask you a couple of questions, all right?
Okay.
This is just to go over your medical history to make sure that you're all cleared.
All right.
Did you ever have any past surgeries?
Yes, I've got a breast reduction before about a couple months ago.
All right, anything else?
No, just that.
All right, do you have any allergies?
No.
All right, are you allergic to any antibiotics?
No, not at all.
Hey, you can't be back here. You gotta go. Hey, bro, you gotta go.
Just gonna document this in your profile. Meanwhile, Jimmy, can you get her vitals for me, please, to make sure that she's all cleared?
Yes, Dr. Zersi.
Thank you. Now, while he's doing that, I'm just going to explain the procedure a little bit. So what we're going to do basically for your liposuction, we're just going to target the areas where there is some fat going around. With that fat, I'm just basically going to use my little handy dandy suction. We're going to suction out that fat, and then we're going to shape you as well. Just to make sure that your waist is nice and tight and curvy. Okay?
Okay, that sounds good.
All right, perfect. And also for the BBL, it's going to be the same thing. We basically just use the sectioner. We're going to shape up your butt, put some fat here, move the fat around, make it nice and shapely so, be able to have a nice look behind after your surgery.
Okay.
All vital signs are normal.
All right,
You
perfect.
got mail.
Ooh, gotta be kidding me. All right, so what we're gonna do is we're gonna step into the procedure room.
Okay.
Now, Leilani, what I'm gonna need you to do is I need you to take everything off. I need everything off, maybe even the wig. If it ain't wig, you girl, it look good. Now I need everything off of you.
Thank you, girl. It's a sew-in.
Okay, period. Come on through, sewing.
I'm sorry.
But I need you to take all your clothes off. I'm gonna give you a patient gown. Once you are fully naked, just say, hey, I'm ready. I'll step back on in. I'm gonna get my handy dandy surgical Sharpie, gonna draw some lines on you, and we can go ahead and get your liposuction out the way.
Okay, perfect.
All right.
Hey guys, are y'all busy?
We doing an RP back here, hun.
Okay, I'll wait till y'all done.
All right, thank you.
Sure.
Privacy purposes. We're not gonna look.
Okay, you can come back in.
All right,
I'm ready now.
All right, I'm coming. Give me a moment. Let me drop this down now, girl.
Okay.
Let me drop it again. Make sure people know. Oh, somebody spawned a car in here. I heard it. All right. So now. All right, so now I'm just going to have my handy dandy marker. And like I said, I'm just going to mark you on up. Target the sections that we're going to take the fat out of.
Okay.
There we go. All right, confirming that you are cleared for surgery. Oh. All right, so I seen a little bit of stuff. You got a little bit of a, I call it a mommy body. You know, ain't nothing too much. Let's see, we got a little bit of fat here around your side. A bit of a pouch in your front. No worries. Doing some drawings. All right. So the dots are the areas where I'm going to make the incision, and just go ahead and use my sucker to just move left, right, you know, just to make sure we get that all out of your body. And also it's going to help shape it as well. Just me, you know, shaping you out. You will be knocked out for this procedure, so please do not worry about feeling any pain. We're going to knock you out real good.
Okay.
All right, you're all set and clear to go. Now I'm going to give you some anesthesia. Just lay down on the table, get nice and relaxed, because you're finna be here for a good while. Just take one big deep breath. Excellent, excellent. Now I'm going to give you some anesthesia. All right, just go ahead and slowly count down from 10 to 1.
10, 9, 8, 4, 3, 2.
Oh, I got eyelash in my eye.
Get me back here.
All right, she's all knocked out. Okay, let's go ahead and get started. Making the first incision now on her left side. All right, good. Doing a little suction and tug. So far, so good. Getting a little bit of fat out of there. Look at that. Okay. Patience. All right, good. Excellent. Just doing a little bit tug. We're almost done on her left side. We're almost done. Just a little bit more. Perfect. All right, now working on patient's right side. Do a little tug. Making first incision now. All right, inserting my suction. She's doing an amazing job. All right. Now she's snoring loudly. Oh Lord, we got to give her a CPAP as well. You hearing that, Jimmy? We're gonna have to send over to the Dimples for a CPAP. Okay, and we getting that last little bit on her right. We're now gonna make our way over to her mid side. I mean, to her front side, my bad.
You've got mail.
Come on now, move around. I should have put my phone on silent. All right. Make a decision here. Her body's coming out nice. I see it. You feel me? Flat tummy. Waist is coming in. She's doing amazing. All right, now what we're going to do is we're just going to get and snip her back on up. Now we're going to bandage her all back up. All right, she's all finished. Okay, Jimmy, if you can, remove her anesthesia for me. Wake Miss Leilani up. And we'll get her back dressed and she can meet me into the office.
Hello, Miss Leilani.
Hi.
How are you feeling?
I feel great. I still feel a little tired. I'm not in pain yet. I feel like I'll have pain after, though.
That's okay. We'll make sure that you're kept comfortable in the meantime. So what I'm going to do is I'm going to bring you over your clothes again if you want to get dressed, and then just meet Dr. Cersei in the office whenever you're ready.
Okay, perfect.
Would you like a glass of water?
Yes, please. Thank you.
Okay, I'll be right back. You decent, Miss Leilani?
Yes, I'm decent. You can come on in.
Here you go. Here's a glass of water. Just make sure you sip it and don't take any large gulp.
Okay.
Okay, you can get dressed whenever you're ready, and then just meet us in the office.
Okay. Some privacy, please. Thank you.
I need some company. Take my time on company. You know what I should do to make a RP real is to play some music. But only in here for me though. Because whole time
Okay.
surgery be blasting music.
Is it okay if I stand?
Yes, ma'am. You go ahead and stand. So basically, I'm just going over your aftercare with you. So it's going to be a lot. So for your aftercare, I'm going to give you a compression garment that you are going to continuously wear, except for when you're showering, for the next 4 to 6 weeks, or about 2 to 3 months, 2.5 months. You're going to be wearing a compression garment. It's going to help reduce the swelling and support the healing. Expect mild swelling, bruising, soreness, and temporary numbness over the treated areas. Those are normal and should improve gradually. As you know, of course, we done took the little vacuum cleaner and then suck up all that fat and made you all shapely, so you're going to be a little bit swollen. No worries, it should be going down, especially with the medicine I'm going to prescribe you. Keep all incision sites clean and dry. Change dressings as instructed. Now, with the garment, I am going to give you a box of dressings that should last you for the time that you will be healed. Please, please, please pay attention to the instructions. Be careful when you are showering because, of course, the dressings would just slip and fall on off. So please be careful. If you have to, get you a CNA and have them wash you up if you have to. Avoid strenuous activity, heavy lifting, and vigorous exercise for 2 to 4 weeks or until cleared by your provider. Basically, you're going to be on some very light duty. So you're going to be a baddie. Baddies don't do nothing. They just sit there and look good. So basically, that's what you're going to do.
Really hard.
So the next instruction is you're going to have to walk lightly. Is encouraged for several times a day to promote circulation and reduce the risk of blood clots. So if you can, please just walk a little bit. You know, you could walk around your house or apartment. Try to do that. I'm gonna say at least 3 to 5 times a day, so that you don't get any blood clots and get the circulation going. Stay hydrated and maintain a healthy, balanced diet to support recovery. I would recommend you to see our nutritionist so that they can make up a plan for you. After this surgery, make sure you are keep making sure you please keep hydrated and drinking multiple cups of water. With the medicine, especially the antibiotic, you might get a little bit of a dry mouth, so please be careful. Moving forward, make sure you take all your medications prescribed to you as directed. Don't take too much within 24 hours because you will get sick and you're going to end up back here in the ER, and I don't want you to do that. Do not smoke or drink. If you smoking vapes, smoking Newport 100s, that's not allowed. Cut waters, vodka, buzz balls, that's not allowed either. So please do not do that, especially when you taking pain medication, antibiotics. No, that's a big no-no. And also, as always, return immediately if you experience excessive bleeding, severe or worsening pain, fever above 100 degrees, increasing redness, foul smelling drainage, shortness of breath, chest pain, or significant swelling on one side. So if any of those happen, please come back and I will check you out. Now, do you have any comments, questions, concerns, emotional outbursts? If you're going to outburst, do it very minimal. I don't want to pop your stitches.
No, I have no questions or concerns. So you'll just forward me to the nutrition department, or do I have to make the appointment myself?
I could put in a referral for nutrition and they could follow up with you for an appointment if you like.
Okay, that'll be perfect. Thank you.
All right. And do you have a pharmacy where I can forward over your prescriptions? I am going to prescribe you ibuprofen, 800 milligrams. That's going to help with the pain. And also going to give you a cephalexin, 500 milligrams. That's a antibiotic for surgeries. So I'm going to put this prescription in.
Okay.
All right, so I sent it over to the pharmacy that's on file. Jimmy, he's going to get your discharge paperwork, and also he's going to give your little liposuction bag where it's going to have the fitted garment and also your dressings. Other than that, you are all free to go.
Okay, thank you so much.
You're welcome. And like I said, I'm going to put that referral in for the nutritionist, and they're going to follow up with you for an appointment. So please pay attention to what the nutritionist is saying. All right.
Okay.
All right.
Miss Leilani, have you got your insurance card?
Yes, I do.
Girl, not you want a hug,
Follow me.
light hug, light hug,
Just a light hug, of course.
a very light hug. I gotta
Hey, stop
play.
pointing that gun at me before we go outside and beat your ass.
Shit.
We're doing a RP back here, y'all. RP back here.
You can do RP. That's cool. I got people following me while I'm trying to do RP.
You're gonna be fucking dead, bitch. And I want you fucking dead.
Hey, catch me
now.
outside. Let's go, you freaky ass nigga.
Oh Lord. Something else I wanted to add, but I forgot.
Am I all good to go now? Jimmy said to tip him.
Just 1 sec.
Okay.
I think that's everything.
Okay, Miss Leilani, your appointment will be scheduled for about 2 weeks' time. In the meantime, I have provided you with an aftercare pack, which will have some dressings. Please try to make sure that they're kept clean, and that the wound is washed as often as possible to try and prevent any infection. But if anything does happen, please just get in touch and we'll check it out. Also, the aftercare pack will have an emergency prescription, so it will have just 1 day's worth of your prescription medication until you can get to the pharmacy, and then you will also find your discharge paperwork in the bag as well.
Okay.
Yeah.
Okay.
Well, thank you so much.
You're welcome. Thank you.
Okay.